Welcome back. If joint pain is creating havoc in your life, or maybe you have pain, but you're not really sure where it's coming from, why it's there, you're going to want to hear about Caring Medical Center. That is where you will find Dr. Ross Hauser. He is a prolotherapist. Good morning, doctor.
Thanks,
welcome
Carly.
back. So yes, we're talking about prolotherapy this morning, and I know you've been on several times before, but this morning we're going to talk about, I think, kind of athletic injuries, which I love too. Not only are you a doctor and an author, this one right here, Prolo Your Sports Injuries Away, but you're also an athlete too, so you can relate to a lot of the athletic injuries that are so common, I think, with athletes. And let's talk a little bit about prolotherapy. And there's two different types of prolotherapy from what I'm learning from
First,
you,
for
right?
your viewers who are here for the first time or hearing prolotherapy for the first time, prolotherapy is a natural injection therapy. So in other words, instead of injecting chemicals or steroids into a joint, we're injecting natural substances that the body already has to stimulate repair. So somebody could have a rotator cuff tear, they could have osteoarthritis, they could have migraine headaches coming from their neck, they could have a ligament injury, bursitis, tendon injury that's not healing. So prolotherapy restarts the natural healing cascade that the body normally uses to get stronger. Like you said, there's two different types of prolotherapy. Regular prolotherapy we call comprehensive prolotherapy, where we comprehensively treat the joint. So when a joint's injured, it's normally not just one part, it's the whole part. But what's really exciting, Carly, is we can take the healing elements out of your blood.
Okay.
So in other words, we could take the healing elements out of your blood, so that's called platelet-rich plasma. So we take out the blood, centrifuge a certain part of your blood, about 60 cc's of your blood, and we get the fraction of your blood, Carly, that has the growth factors. So so imagine like we can concentrate the growth factors from your own body, then inject them into your shoulder, into your hip, into your knee, to stimulate the normal healing cascade, or the normal way the body heals. So you have a meniscal tear, or you have a labral tear, or you got a tendon tear that you don't want to get surgery for, or you're not a surgery candidate. You know, that's kind of exciting. We can take those healing cells and those healing elements.
Well, this is extremely exciting because this is a relatively, it's not you know, not new where you have just been starting this, but it's certainly new to Southwest Florida, one of the only offices that's doing this, correct?
Right, yeah. It's the first office in Southwest Florida that does it full time. So just know that the body has tremendous regenerative capabilities, but sometimes the injury is so severe that your body can't heal it yourself. So what we can do is take your own healing elements, like with platelet-rich plasma, and then inject them into the tissue that's weakened to stimulate it to get stronger.
Now, with this platelet-rich plasma, you know, the kind of the two different forms of prolotherapy, how do you know which one? I mean, I don't know if we have to get that complicated with it, but
when somebody has a tear, like you know you have a rotator cuff tear, or you know the MRI showed a labral tear or a meniscal tear in the knee, right? People think meniscal tear, I'm going to have to get surgery. I'm telling you, when we reviewed 28 cases, we wrote a paper, 28 cases of meniscal tears. When it was all said and done, only one person needed surgery.
But I think people get surgery because maybe they don't know what other options they have. And I think people are so eager to get rid of the pain because it can really be debilitating.
Even surgeons would say, even surgeons would say you should try to exhaust conservative measures before you do surgery. So people, if they have been told they need surgery, or they have a tear like a meniscal tear, labral tear, or you just have a area of pain that you don't know what's causing it, I'd really encourage them
Well, then they just turn to medicine, which you know can sometimes be a longer road than maybe what people need.
Covers it up. Prolotherapy, or platelet-rich plasma prolotherapy, stimulates repair, and then once it's repaired, then you don't have the pain anymore, so you don't have to take medications, go to doctors.
Well, if someone's watching this morning and they think, okay, all right, you have my attention, what is this prolotherapy? How do I find out if I'm a candidate or if I'd be a good fit for it? What would you suggest they do? Well,
it's always good to come in and have either myself or my associate doctor special to examine you and see if you're a candidate for prolotherapy. But on our website, www.caringmedical.com, we have all the different medical conditions. We have our papers, we have the books that we've written on prolotherapy, so that would be a good resource also.
Well, I love how passionate you are about prolotherapy. I think people are going to be very interested to learn that this is just a new option to consider here in Southwest Florida. So thank you for being on the show this morning, introducing us to this. And if you want to find out more about his office, all you have to do is head to our website, fox4morningblend.com.
The road to recovery and the fight against cancer. Up next, we chat with Joan London on how you can nominate a loved one to become a champion against cancer. But first, look at your Fox forecast.